Hi Jackie, how you doing?
I'm good, thank you. How you feeling?
Yeah, I'm feeling good, thank you. Come in.
Oh, thank you.
Hospital care at home is a hospital-grade level of care that is provided at home. Most patients who are admitted under a hospital in the home care would otherwise be in a hospital bed. They need to be stable, obviously, to be in their own environment and managed at home. We are able to provide intravenous medication. It's a complex care and it's equal to the one that the patient would receive in hospital. Patients' care needs can vary. Some patients' care require only one visit a day. Depending on the clinical needs, the frequency of these visits is established at admission. The patient is technically an inpatient, and the patient can be returned to the hospital either on their own request or if the clinical condition deteriorates to the point of requiring a readmission to the hospital. So the benefits of hospital care at home are primarily the patient's comfort. The state of mind is much better in your own environment. And you're not sitting in a room, you can actually be out and about. The health outcomes are much better at home and there are a lot less complications. You get a notification from the visiting nurse or the visiting physician that, hey, I'm coming to see you, and you don't actually have to run your entire day based on, oh, what's going to happen next. They're able to remain socially involved with their families.
The key differences from being in a hospital versus being at home was personal space. I found in a hospital you're sleeping in their clothes, in their gurneys as well, whereas at home you can sit down on your couch, you get to sleep in your bed, you get to eat your own food, you get to wear the clothes that you want to wear, and you can shower in privacy as well. It was just chalk and cheese in my eyes. Being at home was more beneficial for my mental health and also my physical health. I was able to be around my friends and my family. They were able to come and see me and not have a certain time that they had to leave. I was slowly getting back into work. I would actually call the hospital care at home nurses and explain to them, look, I'm going to be working these days and I've spoken to my boss saying I'll be home by 2 p.m. And they accommodated me 100%, which was fantastic. So I was able to get home in time and get ready to receive the nurses, which was phenomenal. I definitely found that a lot of the clinicians that visited me were a lot more personable. I was able to have more one-on-one time and actually ask the questions that I wanted and get the answers in depth at home than what I would have versus gotten at the hospital. And when the nurses were like, are you ready to go home? Yeah, I was more than ready to go home. Give my bed to someone that actually needs it. I know I can heal at home. When you're happy, you're just better physically and mentally. And being in a hospital, like as good as it can be, it's just not home.